Hi everyone, I'm Dr. Uchenna Ossai, pelvic health physical therapist, professor, and certified sexuality counselor, and I'm here to answer your questions in Asking for a Friend. Dr. Ossai, asking for a friend. What is the best exercise for your pelvic floor? Well, that is a fabulous question, and I'm going to say it depends. So here are some of my favorites. The first exercise is going to be diaphragmatic breathing. Get in a comfortable position, put your hand on your chest and your belly, or you can put your hand at your rib cage, and you're going to inhale and imagine that your rib cage is expanding out in front of you, the sides, and behind you. And as you do this, you want to feel your pelvic floor expand and drop between your legs. Another great exercise for your pelvic floor can be abdominal exercises, pelvic floor exercises or Kegels, even squats to help get your legs and glutes in gear. Because remember, the pelvic floor works as part of a team. And if your abdominals are weak, your glutes are weak, your back muscles are weak, and your diaphragm isn't functioning properly, then your pelvic floor can't either. So incorporating exercises that hit all of those major muscle groups are actually fabulous for your pelvic floor. It is also possible to do too many exercises. So if you're noticing your symptoms are getting worse with doing too many repetitions, or you may have added in a bridge exercise or an abdominal exercise, go ahead and pause and consult with a pelvic health physical therapist or your healthcare provider to see what adjustments need to be made specific to your body. Dr. Ossai, asking for a friend. What is incontinence? Is it normal? Is it normal that I pee when I sneeze? Incontinence is when you leak urine without intending to leak urine. So if you're peeing when you're coughing, if you're peeing when you're sneezing, if you're peeing when you're jumping or getting up from a chair or picking up a heavy child, that is not normal. It is a common problem though, which is why a lot of us have been fed that information that as you age, it's a normal process. No, it's common, but it is still a dysfunction that needs to be addressed. Dr. Ossai, asking for a friend. How do I treat urinary incontinence? So there are a couple of buckets we can go in. Let's start with exercises and pelvic health physical therapy. And that way you can be assessed from head to toe on all of the factors that impact your urinary incontinence. Another intervention is behavioral. So we might change your bladder habits, we might change how you pee, how you sit, your posture. All of those things can be very, very important. Another option, it could be a pessary. And that pessary could help position your bladder or your urethra in a way so that you don't leak when you cough, laugh, or sneeze. And last and certainly not least is surgery. Surgery is a great option for people where the conservative approaches are simply not working, or anatomically, surgery is going to be the best place to start. And sometimes you may need to dip your toe into all of those options to get the outcome that you need. Either way, seek help from a licensed medical professional who specializes in urological issues. So you can have your LOLs without the leaks.